Hello again. Did you have a little break? Well, now the second part of Unit 1. This is on transcultural considerations. As time has passed, we have become a very mobile world. There's a lot of migration and global movement all over the world, and that has caused good for all of us is an increased diversity within our communities. In 1974, Madeline Levenger developed a formalized transcultural considerations. She founded the Transcultural Nursing Society, and in looking at that, they were studying ethnopharmacology, which is actually the study of drug responses that may be unique to an individual due to either social, cultural, or biological phenomena. In doing this, you're having to also not only use your nursing background, you have to use some of your social sciences. And it's a very rewarding avenue to get more involved in. It looks at the racial and genetic interactions. It looks at pharmacokinetics. And in doing that, it integrates that. And that's the pharmacokinetics is the process of drug movement through the body to the drug action all the way through to elimination. So it looks at that. It looks at the pharmacodynamics, which is the concentrations and their effects on the body as it relates to genetic and racial issues. It also looks at the pharmacogenetics, like I said, which are drug variations from a predicted outcome due to the genetic factors that are taking place. So these also look at not just the racial and genetic issues, it looks at the efficacy involved in that person's cultural background, the adherence, whether or not they're going to adhere to a procedure because it disagrees with what their thoughts are on taking medications. It also looks at high-risk behaviors than some different genetic or cultural backgrounds, so those may interfere with some of the medications that are being given. There's the Purnair model for cultural competence, and there's a real good article that was written by Larry Purnell. This was originally started as an organizing framework for student nurses to use as a clinical assessment tool. And you can print this out. There's the article was in the Journal of Transcultural Nursing. It's July or issue of 2002. It's volume 3, number 13. And you can pull that up and print it off. It's quite an interesting article. But like I said, it was originally made as an organizing framework to help student nurses to be able to use that in the clinical settings. And it uses 12 different domains. And it looks at the overview or the heritage. Where did that patient come? What is their country of origin? Where are they currently living? And so it looks at the effects of the type of geography of the land. It looks at that compared to their current residence. Looks at the economies and the politics and the reasons for immigration, their educational status and their occupation. So that all comes into play. Then it looks at communication. What is their dominant language and their dialects, and are they having to learn a new language? Do they look at things that looks at like voice tone, voice volume, and the willingness to share thoughts and feelings? Some cultures don't as much as we do, and some people from where they come from share everything, some don't share everything. So all those points play a part in the care of the patient. It also looks at family roles and their organization. Who's the head of the family? How are the genders different in each culture? The workforce issue. Who is, again, with their gender roles and their ethnic communication styles and individualism, how does that all play? It looks at biocultural ecology. It looks at high-risk behaviors like smoking, alcohol use, recreational drug, lack of physical activity, use of seatbelts, helmets, those types of things. Looks at nutrition. Do they have adequate food? Do they have do they make food choices like that we think is appropriate? Some of their rituals and their taboos, some of the things that they do out there. These are interesting things that need to be thought through. Pregnancy and childbearing practices. What kind of fertility practices do they use? What do they use for birth control? Death rights. Now this comes up a lot in the critical care areas that I've worked. Different cultures and how they view death, and some of the rituals and preparations that they do before death has occurred. Some of their bereavement behaviors. They're, different cultures and racial groups are different than others, so you have to honor those and allow that to take place. You also have to think about their religious practices and their use of prayer and their use of behaviors that give meaning to their life, and these all need to be included. And what do their healthcare practices include? What do they do for acute care? What do they do for preventative care? But it's a very good article, and it's very easy to find. Like I said, it was in the Journal of Transcultural Nursing, July 2002, and I recommend reading through it just to get an idea about that. In your book, it does show a nice little graph about all of that. Okay, so a little more. I think I've gone over this pretty good. Some of the other little points about it, though, like in the racial origin and the effect or responses to some drugs, it has been shown that there's an increased incidence in diabetes in both African Americans and Hispanics and in the Alaskan Indian groups. So that was interesting to me. People who live in high altitudes also have an increased blood count, so where they live makes a difference. Poverty is a cultural characteristic that crosses all racial and ethnic groups, and it may impact whether they can buy meds. The nurse may need to suggest generic. Generic meds are cheaper. For clients who read and write non-English, we need to be able to provide them with instructions according to their language, and this is a Joint Commission mandate that has to be done. There are cultures that are uncomfortable with silence. They're also maybe uncomfortable with eye contact and personal space, and nurses need to be aware of all these clients. The concept of time is also different in different cultures. Mexican time versus European time. Getting patients for the first time, you need to be, sometimes the first time they meet, they're very formal. So we have to be aware of these issues. Some of the high-risk behaviors that are out there are things like the tobacco, alcohol, sexual practices. Tobacco use causes a more rapid elimination of meds and may decrease levels of psychotropic meds, and alcohol may increase the effect of analgesics, so we have to be aware of that. Nutritional habits are different among different cultures. The nurse just needs to be able to assess the client's food preferences. Spirituality, including religious preferences, the meaning of life, and individual sources of strength. You need to assess about fasting issues. So when you do your assessment, you have to think about the ethnocultural and racial backgrounds, the time that they've been away from their country of origin, any travel history, like if they've been to another country in the last month or two, their language abilities, any nonverbal communication practices, preferred health, preferred foods and preparation, some of their traditional and folk health practices. When you do your nursing diagnosis with this, you have to think about the development of the culturally congruent diet plan. So you need to think about their diet plan so that the client understands their dietary practices that you are asking them to do related to the drug interactions. So you have to kind of combine that so that they have an understanding of that. Under their interventions, you have to do client teaching. You want to involve their family in the teaching so that they all understand what's being asked of them. You need to provide explanations about all the meds and include any over-the-counter medications that they may get. And you need to do this education at a level that they will all understand. And then to back it up, you need to provide written instructions in that patient's preferred language. So practice question 1. Timeliness for appointments is important for which ethnocultural group? The answer would be C. And on your next slide, there's another question. Research shows us that some African Americans, A, are less responsive to beta blockers than our European Americans, B, are more responsive to beta blockers than Americans, C, experience fewer toxic side effects with psychotropic medications than do European Americans, or D, experience fewer toxic side effects with antidepressant meds than do European Americans. Okay, the answer to that is A. It has been shown that African American population are less responsive to beta blockers than are European Americans. And so a lot of times we will not use a beta blocker, we'll use an ACE inhibitor or a calcium channel blocker to get the same effect on their hypertension. All right, thank you. That is the end of Unit 1, Number 2. So take a quick break and we'll get back with you again. See you soon. Bye.